The pie graph above by the Center for Science and Development shows the leading causes of death in the United States in 2012. 19% of deaths, as seen in purple, are from accidents and suicide, and 81% are diet-related that leads to heart disease, cancer, and diabetes, as seen in blue. The majority of the 81% come from low-income communities. Good morning. We are
Franchesca Menger,
Valeria Salas,
Nina Gehring,
and Fernanda Nakazo. This led us to a research question: to what extent does food deserts in low-income areas impact the overall health of children under 18? Argument is, food deserts have a negative impact on the mental and physical health of low-income adolescents due to food insecurity and lack of resources. Our claims are geographical location, as low-income neighborhoods tend to influence diet by marketing and access to healthy food, physiological stress, where anxiety from food insecurity on parents cause mental stress on their children, and access to health care, as many low-income families cannot afford health care or do not have access to the necessary care.
food deserts are communities where it's difficult to find nutritious and affordable food. According to the USDA, a food desert is where 1/3 of the population lives 1 mile away from the closest supermarket in urban areas, and for rural areas, it is about 10 miles away from the closest supermarket. By this definition, 19 million Americans fall victim to being in a food desert. Many low-income communities fall victim to the effects of a food desert because the processed foods are heavily marketed and available. As you can see in this graph from structural barriers to local food, it shows the food desert counties in the U.S. in 2000. In dark green, it represents food deserts, and in light green, it represents non-food deserts. In the dark green, it is more prevalent in western states and larger urban areas. According to the Ring Corporation, which is a nonprofit corporation, higher income areas have 14 times more accessibility to healthy food providers. Fast food is successful because it is more affordable and less time consuming. For example, one can buy a meal from Wendy's where they offer their 4 for $4 meal, which is their meal for $4, whereas finding food that is healthy and nutritious, which consists of fruits, vegetables, dairy, greens, and protein, is more expensive. Not to mention the price of the ingredients alone, finding these ingredients where it's not accessible, and the time and preparation it takes, which most people don't have as they're working 2 to 3 jobs. The consistent consumption of processed foods cause diet-related health issues such as diabetes, high blood pressure, and heart disease. In this graph, by the Science Blog by Saunders, in blue it shows healthy foods, which consist of fresh fruits and healthy veggies, and all fruits and veggies, fish, and in the red it represents unhealthy foods, which consist of fats and oils, sugars and sweets, carbonated drinks. The foods in red that are shown are more commonly found in fast food areas and are consistently consumed by people who live in food deserts. This graph by the USDA shows the predicted prevalence of less common chronic diseases by food security status in low-income areas. In the light blue, it shows high food secure individuals, and in the dark blue, it shows low food secure individuals. As you can see here, the low food secure individuals are at high risk for these diseases such as CHD, which is coronary heart disease, hepatitis, stroke, cancer, and kidney disease.
The stress of food insecurity in low-income families causes them to be major targets of large tobacco companies as they prey on the poor coping mechanisms used. About 3 out of 4 smokers are at or below the poverty line. Continuously, the subconscious stress caused by food insecurity on parents and families has had an extensive negative impact on their child's emotional health and well-being as they have to be forced to choose between eating and other essential needs. In the graph provided by Cambridge University Press, light blue represents no signs of anxiety and the orange represents signs of anxiety that are prevalent. As you can see, the more severe the food insecurity is, the higher the rates of anxiety are. As on the other hand, the food insecure individuals show increasingly fewer signs of anxiety by almost 19%. Many low-income individuals turn to substances such as nicotine and develop nicotine addictions. Because of this, at first, nicotine improves mood and concentration, decreases anger and stress, relaxes muscles, and reduces appetite. With appetite being reduced because of nicotine, the need for food becomes much more minimal.
Many low-income families are being forced to choose between essential needs. One common necessity that is budgeted out in healthcare insurance is providing food and housing for low-income families. Low-income individuals are not in position to take preventative measures on their physical health when they are being forced to eat high-processed foods because it is more affordable. Low-income individuals are not in position to take preventative measures on their physical health when they are being forced to eat high-processed foods because it is more affordable. Low-income individuals are not in position to take preventative measures on their physical health when they are being forced to eat high-processed foods because it is more affordable. If they do experience diet-related diseases such as heart disease, they will be, and cannot afford care, they will be added to the 1.5 million people who experience diet-related diseases. Looking at the graph by ACA coverage expansions, and on the top in light blue, it represents uninsured individuals. On the bar graph to your left, low-income workers percentage is 18% higher than the higher income workers. Due to the lack of low-income workers, some children may suffer from health disparities, which is a particular type of health and is closely linked with social, economic, and/or environmental disadvantage. According to ACA, low-income individuals are especially sensitive to official increases to medical out-of-pocket costs, and modest copayments can have the effect of reducing access to necessary medical care. Low-income individuals do not have the same opportunities because to achieve effective health due to the price of care without insurance.
Our first solution would be SNAP benefits, which can be used to buy fruits, vegetables, and meats for free or for a reduced price. However, not all families are eligible for SNAP benefits, as a family has to make $1,080 a month or less, or be below the general poverty line, and SNAP benefits cannot be used to get medication. Our second solution would be raising awareness, such as informing schools and families about healthy diets. However, simply raising awareness might not be enough, as families still might not have enough money to buy foods for said diets. Our resolution is the effects of food deserts can be minimized by making nutritional food more affordable and providing care for low-income families. Here are resources. Thank you. Any questions?
All right, so Nina, we're going to start with you. Nina, how did the group decide to include Franchesca's perspective in the overall presentation?
We included Francesca's perspective on eating habits because it covered like most of the ground for all of our perspectives, and it helped us realize for low-income families on what they eat and like how they will be.
Okay, thank you. Franchesca, reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem your group identified?
I think Fernanda's claim of geographical location had the greatest impact because it showed how people living in low-income areas can be geographically located and how that affects what they eat and their overall health.
Thank you. Fernanda, what is a way in which your team's resolution makes you think differently about your own research?
Our resolution was how food insecurity and lack of resources affected mental and physical health, and I think that changed my own perspective because I only talked about physical health from geographical location, and seeing that, for example, Val's IRR talked about mental health and how it can also affect mental health.
Okay, and Val, you're up last. If you had another team member, what perspective or limitations could they have reached that would have made a useful contribution to the project?
If we had another team member, we would definitely include the cultural aspects to how eating habits affect culture and which cultures have worse eating habits and live in a more populated food desert than other cultures.
And you are done.